I'm pleased to welcome Sharon Rapnicki today to our joint Triad and RSVP monthly Zoom. Uh, Sharon's a peer specialist at the NAMI Dane County office, National Association for the Mentally Ill. Did I get that right, Sharon?
Correct.
Okay. And she's got a lot of experience working in this field, and I'm not going to take up any more of her time. Sharon, please take it away.
Okay, thank you. Thank you, Kate and Mike, for having me. And welcome, everyone. Good afternoon. Hopefully, everyone's getting their Christmas shopping done and staying warm. This picture represents to me a beautiful brain, and it has flowers in it that can signify growth. And that's what my goal is every day, is to keep my brain beautiful and healthy. A little bit about myself. I grew up in Michigan and was there for many years. And then I transferred to Indiana with my husband. And I love to golf and read and help people. That's my passion. My husband's my biggest supporter. I do have a mental illness, bipolar, but he is a cow doctor. So you can only imagine what our conversations are and how he smells when he comes home from work. So I work at NAMI Dane County. Oh, let me back up. I just wanted to say that I work at NAMI Dane County as a certified peer specialist, and I use my lived experiences with mental illness to help other people. We get together on a weekly or bi-monthly basis, either through a phone call or they come to my office, and I help them with their mental health challenges, helping them identify solutions and set goals. So today I'm going to talk about a couple of different areas. First, I'm going to introduce NAMI and then talk about mental health and mental illness. I'm going to cover aging, self-care, and then I added some other things in there that you'll get to see. NAMI stands for the National Alliance on Mental Illness. You Are Not Alone is our logo. There's been a book written by NAMI that is You Are Not Alone, which is an excellent book. NAMI National started in NAMI Dane County. It was founded by three mothers who got together and had their own little support group because their sons were suffering with psychosis, bipolar, and schizophrenia. And they got together every week and talked about their challenges and learned from each other. And then that grew into this huge national organization with 600 affiliates. And there's also NAMI Wisconsin, the state office, and NAMI Dane County. So NAMI National, just to go back, has 600 affiliates. They raise awareness, provide support and education. There's 49 state organizations. So each is like an office, an affiliate. They advocate at government levels. They lead with awareness initiatives, and they have a major NAMI walk every year. We just had our walk in September, and we raised $280,000 that pays for all of our services because our services are free. And so those walks are really important. NAMI National has podcasts, and they provide emotional support. There's a hotline where they provide mental health information and resources. Then each state has an office, a state office, and there's 28 affiliates in Wisconsin. They provide support groups, programs and education, presentations, such as the one we're doing today. Ending the Silence is for youth. In Our Own Voices is when we go out and we share our stories. Hearing Voices and sharing story with law enforcement. NAMI Dane County, we provide support groups as well. We have our adult one, which is virtual and in person. We have a family support group that's virtual, a Being Together, which is everyone in the state can attend, a women's health, and a young adult. We have educational classes that go into more in-depth knowledge about mental illness. We do the school and community presentations. Again, we do advocacy. And then we have an outreach line where we take telephone calls every day and we get emails. And then CIT and CIP is Crisis Intervention Training and Crisis Intervention Partners. And that's our law enforcement and 911. And we have a program office that specifically goes out and trains officers on how to de-escalate mental health crises. And we've trained, it'll come up how many we train, but we've trained all of Madison and then the surrounding areas. We also provide peer support. We have a peer specialist, which that's me. Then we have a parent peer specialist, and she's also a peer specialist, Alika. And then she's a recovery coach too. We have events and programs, resource guides. We have a resource guide that's online in case you need any resources in Dane County. And then we go out and handle resource table events where we bring our resources, all of our documentation. And then, as I said, we have the NAMI Walk. So what do we achieve with all of our donations and the money that we raised through our walk? Well, we had 164 programs that were in person and virtual support groups. We have 20 trained volunteer facilitators that handle our educational classes and our support groups. And we trained 185 law enforcement officers, and we had 6 crisis intervention partner trainings. That was with 911. Outreach, we took 867 calls and processed emails. We did 66 community presentations, and then we engaged with 3,597 people. And then we have 51,000 website visitors. We had 2 legislative sessions, and we have 30 volunteers serving our advocacy committee. So let's talk about mental health and mental illness. Mental health is the way we think, feel, and how we relate to others. It's the way our brain functions, it's our environment, and our lifestyle. Everyone has mental health, but not everyone has mental illness. Mental illness is our illnesses that are treatable and common. A mental health condition isn't the result of one event. Biochemical and brain structure may play a role too. So mental illness is common. 1 in 5 people live with mental illness. That's a lot of people. The other 4 out of 5 know someone with mental illness. And then 1 in 25 people live with a serious mental illness, such as schizophrenia, bipolar, borderline personality disorder. What causes mental illness? Our environment, situational stressors. I know for me, I mentioned I have bipolar 1. Stress is my trigger. If I'm under stress, then I have episodes with bipolar. Biochemical imbalances in the brain, genetic factors, and a combination of all these factors. I know for genetic factors, my doctors told me when I was diagnosed with bipolar that I had the gene from my grandmother who had mental illness. Some common types of mental illness, we have depression, anxiety disorder, post-traumatic stress disorder, which is also known as PTSD, schizophrenia, bipolar disorder, and borderline personality disorder. So depression, which also can be known as major depression, is common, but it's a serious mood disorder. Some symptoms: how you feel, think, and handle daily activities, such as sleeping, eating, and working. With anxiety disorders, where people feel anxious, have racing thoughts, for some people, the anxiety does not go away and can get worse over time. Some of the symptoms include fatigue, difficulty concentrating, headaches, sleep problems. And these symptoms can interfere with job performance, school, and relationships, to name a few. Post-traumatic stress disorder, PTSD, is a disorder that develops in some people who have experienced a shocking, scary, dangerous, or traumatic event. People may feel stressed or frightened even when they are not in danger. Not everyone with PTSD has been through a dangerous event. Some experience things such as an unexpected death of a loved one, which can also cause PTSD. Schizophrenia is a serious mental illness that affects how a person thinks, feels, and behaves. It may seem like they have lost touch with reality, which can be distressing for them and for their family and friends. People with schizophrenia are usually diagnosed between the ages of 16 and 30. Borderline personality disorder is a mental illness that severely impacts a person's ability to regulate their emotions. They may experience intense mood swings and feel uncertain about how they see themselves. They may act impulsively or recklessly. People tend to view things in extreme, either all good or all bad, with borderline personality. And then bipolar disorder, I'm going to talk about in my story. And I wanted today to share my story, my journey with my mental illness. I feel that it helps people get an appreciation for how it is to live with mental illness. And it started when I was 10. I was in a horrific fire. And still today, just talking about it, I can see those amber waves of fire hitting the house next door, standing outside, being 10 in the cold, watching my house burn down, knowing that I've lost all of my toys, all of my clothing. I just had the clothing that was on my back. Fortunately, everyone got out of the house. The fire department said that it was an electrical fire, and that's what it was. We ended up going to my grandparents' house and living with them, and that was really hard because my grandfather was an alcoholic, and living in that environment was very difficult for myself as well as my family. But we did eventually move, and they rebuilt our house. I got married when I was 20. Through my years up to 20, I suffered with depression and PTSD from the fire. And still today I have it, the PTSD, where I'm afraid of candles, a gas stove, curling irons, leaving them on. So that still affects me today. When I was 20, I got married, and I went through 7 years of infertility with a high-functioning alcoholic husband. And unfortunately, going through that ended up in a divorce. And when I got divorced, I had a psychotic break. And leading up to that psychotic break, I have like racing thoughts and hallucinations. I can hear people talk. I can see people that aren't there. So leading up to that psychotic break, it's very scary. And then I fall into a depression after that. I was diagnosed, when I went to the hospital, I was diagnosed with bipolar. And with bipolar, you have bipolar 1, which I have, which is experiencing hallucinations and psychosis, along with mania and depression. And then there's bipolar 2, where it's more of mood swings and depression. There's generally not psychosis or hallucinations. So I was diagnosed with this, and I was angry. I was sad. I felt I had self-stigma. I just wanted it to go away. And I didn't deal with it well. I lived on this roller coaster ride, having mania. With the bipolar, you have mania, which are racing thoughts, spending sprees, not sleeping, not eating. And then I would have that for about 2 weeks, and then I would fall into depression that would last for about 6 months, and a deep depression where I had a hard time getting out of bed. It would typically take me 8 to 12 months before I was highly functioning again. And from the year 2000 and 2010, I had 8 hospitalizations. So I've had several years of being ill. I had a job. I was in IT management. I traveled a lot. And then from the stress of traveling, I would get burned out. And then I would have a psychotic episode, and then the whole process again of going to the hospital and then healing from that. One time I was traveling, and I came home, and I was at my mom's house watching their house for the weekend. And I started feeling like my head was racing. And then I was like seeing things, and I ran outside, and it was raining, and I ran to the side of the house, and I was on my knees crawling and screaming. And the next thing I knew, the police came, and they took me to the hospital. In the hospital, my doctors told me I had to start taking my medicine and changing my life. But I continued to travel and be in denial with this illness. It affected my family. It affected my friends. So for the next 3 years after that incident at my mom's house, I kind of just floundered. I was in and out of work a lot on leaves from the mental illness. So then I had another psychotic break, and I was off work for a year. And I received termination papers. I lost my job when I was off. And that caused stress. I ended up losing my home, my job, my dog, and I was homeless. Fortunately, my dad took me in, and I stayed in his basement, which was hard because it was dark. And I just tried to work on myself, but I wasn't working hard enough. One night I woke up with racing thoughts, and I went upstairs, and I walked outside, and I went next door to the neighbor's house, and I started asking for Oprah. So I started hallucinating on the neighbor's porch, and they were saying, "Get out of here, crazy lady." And I just kept pounding and saying, "I'll pay you to let me in." And the next thing I know, the police showed up again, and they were really good. The police, it was the best experience. They just asked me my name, and they built a relationship with me. They asked me questions, and then they took me in the house and told me they were going to take me to the hospital. So when I went to the hospital, I was the worst patient. I wanted to be out. I didn't attend support groups. I didn't listen to the nurses or doctors. I was trying not to take my medicine. I just wanted to end my life. And I had suicidal thoughts. But then after about 2 weeks being in the hospital, the doctors and my parents and my priest, they had an intervention with me. And they all said, that they love me and they'll support me, but I needed to change. And I listened. I got out, and I probably floundered for a year, not working, living in my dad's basement. And then I just one day woke up and said, I'm going to change my life. And I started attending 2 support groups. I started, tracking my moods on paper. And then when I went into my psychiatrist, he could see how my moods were. I read everything I could on bipolar. I exercised. I had a therapist. I had a coach. I did everything I could possibly do to get better. And it took me about 3 years before I could really see a big change where I was starting to be highly functioning. I was working. I met my husband, who I'm married to today, and he supported me. And I haven't had a hospitalization or a psychosis break or an episode since that day, since 2010. So that's been 15 years. And it's been a lot of work. I put a recovery plan in place, which I identify all of my triggers, how to take care of me, what my crisis plan is, my doctors, and gave that to my parents and friends and my family. I ended up volunteering for NAMI when we moved to Indiana. And then after we moved to Indiana, we moved to Wisconsin from Indiana, and that's when I got involved with NAMI here. And the NAMI has saved me. I'm able to work with people that have mental illness. I can help them through my experiences. And it's really changed me a lot. And it's like I've climbed up this mountain and I'm up there and I know what to do not to fall. So mental illness is treatable, as you can see from my story. There are many tools that can improve the experience on the journey to recovery. Education, learning about your diagnosis. I used to go into the doctor's office and take questions and ask him question after question just to get educated on the illness. Social support with professionals or peer groups or support groups. I've attended those and still do today. Medication. I was on 7 medicines when I first got sick with this illness, and now I'm on 3. So that's through counseling, and then understanding your healthcare options, your insurance and your medication is so important, and involving your family and friends in your treatment. And language matters. Instead of referring to someone as mentally ill, say they live with mental illness or a mental health condition, rather than saying a person is bipolar. We should say they have bipolar. And one thing I wanted to mention is when I was diagnosed with bipolar, like I would self-stigmatize. I would say that I'm nuts or crazy or why do I have this illness? And I was closed off with it. I never talked to anyone about it, barely my family, even though they were supportive, barely my friends, until I moved to Indiana. And I was on a mental health task force, and I got up and said that I lived with bipolar. And it was like 1,000,000 pounds were off my shoulders. For so long, I kept it a secret, not talking about it. And I wish I would have opened up about it sooner because that really helped me. So centering the person in our language is an important step to decrease against people with mental illness. Some data on mental illness, which is astonishing. 859,000 adults in Wisconsin have a mental health condition. So that's more than 3 times the population of Madison. In Wisconsin, 244,000 live with a serious mental illness. More than half the people in the U.S. did not receive any treatment in the last year. Of the 266,000 adults in Wisconsin who did not receive mental health care, 37% did not because of cost. That's a big issue, is the cost. Medication is very expensive, and my heart goes out to the people who can't afford to purchase medicine. 5.8% of people in Wisconsin are uninsured, and there's 4,515 people in Wisconsin that are homeless. So it's important to support someone with mental illness. And how do we do that? First off, we listen without judgment. We let them speak freely without interrupting or offering unsolicited advice. We avoid minimizing their feelings, and we use validated phrases like, I'm here for you. Using I statements is important just in communicating on a daily basis, but especially with someone that has a mental illness. You're saying, I'm here to help you. I trust you. I hear what you're saying, instead of saying, you should do that. You should do this. You should do that. So using I statements are very important. You want to educate yourself to learn about the specific condition. Understanding symptoms and triggers are so important. It helps you with informed compassion as well. You want to be patient and present. There will be good days and bad days. So showing up to someone consistently helps them even when they withdraw. So check in, send a message, a text, or sit quietly with them. Encourage professional help. You can gently suggest therapy or counseling, or offer to find resources. But most of all, respect their space and decisions. Do not push them. Respect boundaries. Again, do not pry. Let them set the tone for how much they want to talk or engage. Support doesn't mean fixing, it means being there. And take care of yourself too. That's so important. Setting boundaries to protect your own mental health. It's okay to say no. It took me a long time to say no in a polite way, but it really helps with protecting your boundaries. Consider joining a support group for family and friends. So go into a support group for yourself as a family member also helps yourself and the family and the person who has mental illness as well. And then most of all, celebrate the wins, acknowledge progress no matter how small, and reinforce their strength and resilience. Understanding the differences. I wanted to bring up that with mental illness, I had burnout, which triggered the mental illness too. And it's really important to take care of ourselves. And there can be vicarious trauma and compassion fatigue. So for burnout, and we can use a workplace as an example, the core cause could be chronic workplace stress. A key feature is exhaustion, cynicism, reduced performance, and disengagement. It commonly affects anyone under sustained pressure. And we need to recognize the signs, like feeling drained even after rest, decreased productivity and motivation, and sleep issues. For vicarious trauma, the core cause is repeated exposure to someone else's trauma. And that happens with me a lot in my peer discussions. Someone will talk about an episode or having a psychotic break. And then later that evening, I'll start feeling like I have racy thoughts and I'm thinking about my own trauma. So it's important that we take care of ourselves and recognize those signs. Key features are intrusive thoughts and emotional numbing. Commonly affects helpers, therapists, social workers. So we need to recognize a signs such as nightmares, difficulty trusting others or feeling safe, and emotionally withdrawing. Compassion fatigue, the core cause is emotional strain from caring deeply. Key features, emotional exhaustion, reduced empathy, physical symptoms. It commonly affects caregivers, health workers, counselors. Recognize the signs such as being overwhelmed, physical symptoms like headaches or fatigue or frustration. And then we want to manage these stressors. So first off, we want to set boundaries. We want to limit work hours if we can and take breaks. We need to delegate tasks and reduce our overload, or seek support and talk to a supervisor, peer, counselor, friend. Reassess goals, align work with personal values. For vicarious trauma, we need to debrief regularly, talk through difficult situations with colleagues and management. limit our exposure, rotate duties if possible, practice grounding techniques such as mindfulness and journaling, and then seek professional help such as therapy. And lastly, for compassion fatigue, we can practice self-care rituals, prioritize rest, hobbies, and nutrition, share experiences with trusted colleagues, set boundaries, and reflect on the impact of your work. We're going to just touch a little bit on aging and how aging influences mental health. Things such as life changes can affect our mental health. Retirement, bereavement, and social isolation triggers depression. We can get chronic illness as older adults. We can get heart disease. Actually, anyone can get heart disease. Cancer and sleep problems are at higher risk for depression. Caregiving, their stress. Those caring for a loved one, such as Alzheimer's, can also experience depression. And aging brains undergo changes that may increase susceptibility to mood disorders. So what can we do about aging and mental health? Early detection, regular screenings by providers will catch our depression and anxiety before it deepens. Access to treatment, such as psychotherapy and medications, are proven to help. Good life choices, such as physical activity, good nutrition, and mental stimulation protect the brain health. And we need social connection because loneliness is one of the greatest threats to mental health. So staying engaged with family, friends, and the community programs is vital. We'll talk a little bit about holiday stress. The holidays are coming up, which can be a very stressful time. Why holiday stress happens? There's sometimes financial pressures with having to give gifts, the cost of travel, going to events, that all constrain our budgets. Family expectations, navigating traditions, conflicts, or grief. I know in my family, we have a divided family, and it's very hard at Christmas time. We have to go to both places, and there's just a high level of emotions during this time. Perfectionism, social media, and culture ideals amplify the need for flawless holidays. The expectations are set so high to have that perfect gift, the perfect wrapping, the perfect family. And we need to be aware of that. Time demands balance in work, social events, and personal needs. And I'll talk about self-care for the holidays in a little bit. Looking at life transitions, specifically senior life transitions, that's major changes in later adulthood. And some of these transitions are retirement, health shifts, family role changes, and relocation. And our goal, show these transitions as opportunities for growth, not just challenges. With retirement, the challenge is loss of professional identity and your daily structure changes, and then there's financial adjustments. So the opportunity is to volunteer and mentor, pursue hobbies and passions, and lifelong learning programs. Health and aging, physical changes. There can be mobility changes, chronic conditions, energy level changes. Our mental health, coping with loss, maintaining resilience is important. Some strategies is rehabilitation and exercise and building supportive communities. Identity and family roles shift from being, when you go through a life transition, you're shifting from being a caretaker and a provider to being a storyteller about your life, your legacy. So there's an opportunity to pass down these traditions and stories and strengthen our intergenerational bonds. Relocation and lifestyle changes happen with life transitions. The reasons people want to downsize, they want to go into retirement communities, possibly, and there's health needs that need to be taken care of. Challenges, loss of familiar environment, and loneliness can happen. Opportunities is new friendship and activities and rediscovering our passions. Personal growth and meaning. Transitions are opportunities for reflection and renewal. Seniors often rediscover purpose through service and they have joy in relationships. Some key takeaways. Senior life transitions are not endings but beginnings. They demand courage but offer growth, and aging is transformation, not decline. So I said we were going to talk about some self-care strategies that you can use every day as well as during holiday time. One of the most important things, and I found this for myself, is to establish a routine, to have a daily schedule, but make sure you relax. If you can exercise, that's great for your health, and having hobbies is important. Practice mindfulness, meditation, or yoga. Prioritize your sleep. Regular sleep schedule is important. I know that is, especially with my mental illness. Create calming bedtime routine. Healthy nutrition, connecting with others and not being isolated. Set boundaries, learn to say no, protect your time, and engage in activities. Also, you can seek professional help if you need to. Sometimes self-care isn't enough. Reach out to a professional if needed. Practice gratitude. Sometimes having a journal and just writing down what you're thankful for is important. Limit your screen time, especially before bed, and celebrate your progress most of all. Thank you.
Well, thank you, Sharon. Terrific. A lot of great information here. I was just thinking, you know, mental illness seems to be widespread, in our society these days. You see awful things happening. It's just,
Yes.
you know, I don't know, crazy things are happening. And I'm just wondering, if someone realizes that, there's something going wrong, I just can't, I don't know what to do, but my thought patterns are off, you know. I mean, we see these guys who, horrific crimes, practically an everyday thing. How does somebody who's thinking, well, geez, what I'm thinking isn't right, how do you get started on the path to correcting, these thoughts, I guess? I don't know.
Yeah, I think the first thing is being self-aware, realizing that you are having these thoughts and they're not right, and then seeking professional help, either through a counselor or a psychiatrist. Taking care of yourself. Sometimes the thoughts, they may not be hallucination thoughts, but it just may be negative thinking, and identifying like the root cause of what's causing that thought and trying to come up with a solution, either through help with a counselor, your family, or friend.
Yeah, that sounds like a simple thing, yet, it must be very difficult. I mean, I'm looking at, we have these, I mean, every day just terrible stuff going on. The whole world seems so negative. I mean, you have people walking into classrooms, and shooting up the place, heading down to the beach, shooting up the place into a school. It just, there's so much bad news. Bad driving. I mean,
Right.
you know, it just, there's a lot of negativity and trying to, I guess, trying to deal with all of that. I don't know about the rest of you guys. Feel free to chime in if you want to talk with Sharon here, but got a great opportunity to just try and pick her brain a little bit on this stuff. I mean, you have tremendous experience dealing with people who are trying to work things out, right? Just,
Right.
I don't know.
I actually have one quick question, if you don't mind, Sharon. It's about your story. And first, I want to say thank you so much for sharing your story with us.
You're
That's
welcome.
very brave, and it's enlightening for all of us who listened. But I'm kind of curious. I know it sounded like up until you had that kind of aha moment where you're like, I need to face this. It seemed like there was just a lot of um, kind of, I don't want to say dragging your feet, but like you just weren't ready yet. You know what I mean? To really face it and to really find that pivot point. And I'm just curious what you think finally gave you that moment of clarity of I actually need to go get help. I want to be better. Like, was there anything that you noticed that was leading up to that moment? It seemed like it was a moment the way you described it. And I think that's so neat. But for everybody else, what if we don't get the moment? Or how can we try to find that moment that really turns our life around?
Yeah, for me, it was my doctors consistently telling me that I was damaging my brain with every psychotic episode.
Really?
Yes, and it scared me. And that last hospitalization in 2010, where I went to the hospital because of trying to see Oprah, um, that did it for me. I was reflecting on how I was in the hospital. This was all after I got better, like after 8 months. I was reflecting back, and I can remember all my episodes.
Mm.
And I was reflecting back and thinking, like, the people I've hurt, my family, saying things that I don't mean to say when I'm sick. Being rude to my doctors. Like, I was reflecting back on all of that and thought I can't continue in this fashion. And so I made a commitment, but it didn't happen overnight. Like I said, it was 3 years before I felt I was a different person, where people were saying to me, Sharon, you're a different person. You're not like how you used to be. And I always thought I could control it. I was a big control freak, and I've given that up. But I always thought I can control my path, and I couldn't do it alone.
Hmm. Thank you. So that moment where you realized you needed help, it wasn't like that was the moment life became good. After that moment, it took 3 years to
Right,
really find solid ground, really.
right. It was a
Yeah.
lot of self-reflection,
Yeah.
uncovering a lot of deep-rooted problems with my therapist. Yeah, it was a lot of work.
Yeah. And so if somebody feels like they need to contact someone, would NAMI be a good source for
NAMI
somebody to
would be a good
call?
starting point, but
Okay.
there's also 988, the mental health line,
Okay.
emergency number. There's a
Okay.
Dane County Crisis Center. Um, and on our website at namidanecounty.org, we have all those resources listed with the telephone numbers.
Great.
So that's a good resource.
Okay. Sounds good. Well, I just think it's so wonderful that your family supported you and that you have a good system in place to,
Mhm.
to help you because you said it does take a village, it sounds like.
It
So,
does. And one of the hardest things was learning the difference between a funk, just kind of like a normal depression that everyone gets once in a
yeah.
while, and am I getting sick depression. It was learning the differences between those two, and that took some time. Just a lot of self-awareness, tracking my moods, monitoring my sleep, all these things that I do on a daily basis so that I don't go into psychosis,
Mhm.
is really important. But my family's been very supportive, and my husband's very supportive. And I just got diagnosed on top of this. I got diagnosed with seasonal affective disorder.
Mm.
So I feel like I'm really, like, my moods are real low, and I don't have a lot of energy. You can hear it in my voice too, and that's from the seasonal affective disorder. So I had a video meeting with my doctor right before this meeting, and they adjusted my medication. So hopefully in like 3 weeks, I'll be telling a difference or feeling
Mhm.
a difference.
Okay. Good. I know seasonal affective disorder is very common for a lot
Yeah,
of us, and winters are very long here in Wisconsin. So I know
they,
I upped my vitamin D and, I'm trying to find ways to exercise because I know that's really important for the dopamine and
yeah,
good mental health. But it's harder when it's bad outside.
it
So it
is.
just it presents a challenge. So
And I do the light therapy every day for like 10 minutes. That helps too.
is it would they call them
The
happy lights?
light. Yeah.
Okay.
Yep. Yep.
I have one here in my office. I'll make sure I use that more.
Yep.
Does
Those
it,
are important.
yeah. Does anyone else have any questions for Sharon while she's here? It's a great resource. Okay.
I thought I might ask if I can chime in here for a second. Now, Sharon, you mentioned that you do trainings with MPD and the sheriff's office. I'm wondering, have you ever had a chance to go out on, a call with Madison Cares, the Cares mental
The
health unit?
CARES team.
Yeah.
No, I haven't. NAMI Dane County has not done that yet, but it doesn't mean we're not going to do it in the future.
Mm.
So I think that would be so helpful. I know with me, with my police exposures, having someone there who's been through a mental health crisis would have helped a lot.
Mm-hmm. Yeah, that'd be very interesting. And also another thing I was thinking about, the screen time. You mentioned specifically screen time. Do you find that, a lot of people who you talk with also spend a lot of time on, their devices,
Yes, they do. So I have one person that gets up in the middle of the night and checks their phone
Oh,
and is on their phone, and then they go back
mhm,
to bed. And I just, we've been working through that, but it's a habit, and but it affects us.
mhm. So much of the news is very negative, and you're constantly bombarded with this sensationalistic stuff. It's,
Hmm.
I can see where, you know, you could be pushed, into a spiral of ill health.
Right. Well, I've noticed that in talking to some of my peers, like since the election and TV, just in general, like you said, road rage, all these things are taking a toll on them. They have stress because of it. And so taking care of themselves is the most important thing through some of the self care strategies I talked about.
Yeah. Yeah. Great. Anyone else, please chime in.
Well, thank you, Sharon, so much. We really
Okay.
appreciate your time and your
Sure.
experience, and I wish everybody a happy holiday, and remember to take care of ourselves. Sharon
Yep.
told us to.
Yep. Thank
Terrific.
you, everyone, for coming, and happy holidays.
Okay, take good
Thank
care.
you,
Okay.
Sharon. And thanks,
Bye-bye.
everyone. Bye.
Bye.